Oman is a beautiful country, and more people are choosing to live and work there. However, if you live and work there, it's important to have a good quality health insurance plan. Today, there are lots and lots of different international health insurance companies, and our job as one of the leading global intermediaries is to help you choose the right plan. Most insurers today build their plans in a fairly modular form. This means there's an inpatient component, an outpatient component that would include things like medication, GP visits, diagnostic testing. You can choose to add on maternity, optical, dental. Plans today can very often cover pre-existing conditions. If you live and work in Oman, evacuation is going to be important to you. In the case of a serious accident or illness, there's a reasonable chance you might need to be evacuated to Dubai. If you're looking for a good quality international health insurance plan, then come and talk to us. As one of the world's leading intermediaries, this is our field of expertise. We look forward to talking to you.
Welcome to Phoenix Children's Hospital Family Seminar, Understanding the New World of Health Insurance, presented by PCH's Family Financial Services. Today we're going to take a brief look at the history of healthcare costs. We're going to break down some basic components of coverage, and we're going to discuss 4 basic areas to consider when selecting a health plan. Then we're going to look at some specific examples and scenarios to demonstrate the difference in the options that you have. My name is Lori Handy Oldham, and I'm the Director of Patient Access at Phoenix Children's Hospital. My responsibilities include admitting, registration, pre-registration and authorizations, and family financial services. My co-presenter today is Michael Timmons. Michael is one of our family financial services counselors. He's been working in healthcare for over 20 years. He's got extensive experience in financial counseling, clinical operations, and patient advocacy. So we hear a lot about the rising costs of healthcare. These graphs show a comparison of the rising costs of healthcare as contrasted with the rising incomes in American families since 1970. The first graph shows the increase in the percentage of income a family spends on healthcare from 1970 through 2013. You can see that in 1970, the average family spent a little over 5% on healthcare. Last year, that percentage rose to over 20%. The second graph contrasts the rise in wages or income compared to the increase in healthcare spending. The first bar represents the percentage of rise in wages, and the second bar represents the percentage rise in healthcare spending. As the graph indicates, wages are clearly not keeping up with the out-of-pocket costs in healthcare. So what does this mean? Very simply, it means that a much larger portion of your family income needs to be spent on healthcare than ever before. With the rollout of the Affordable Care Act, high deductible plans and large coinsurance amounts are not only increasing, they're here to stay. This is the Choluteca Bridge in Honduras. Honduras is in Central America, with the Caribbean Sea on one side and El Salvador and the Pacific Ocean on the other side. So it's positioned ideally to get struck by hurricanes. This bridge was a gift that was given to Honduras by Japan. It was built to sustain significant hurricane winds. So, as you can see, it did sustain the hurricane winds quite well. This is the same bridge, this photo shows the same bridge after Hurricane Mitch hit Honduras in 1998. As you can see, the bridge is fine, but it no longer spans the river. The river actually shifted with the high winds. So while well built, this bridge no longer has a purpose. This analogy plays out in healthcare as well. Our health plans and personal budgets and decisions that worked well for us in years gone by will not serve us in the future, no matter how well they used to work. We cannot go back and try to reroute the river under the bridge, just as we cannot turn back the clock on high deductibles, coinsurance amounts, and narrow network health plans. We need to find a new way to cross this river. We're going to begin our discussion on the components of healthcare at a high level, and we're going to peel back the layers as we go. Let's look at the major players in healthcare arena. At the highest level, health plans can be broken down into two primary payer sources, government plans and commercial plans. And by payer sources, we're referring to an entity that traditionally pays the cost of healthcare services. Government plans, such as Medicare and Medicaid, pay for medical costs, often without a monthly premium, and little or no out-of-pocket amount due from the patient. Commercial plans are private companies or sometimes publicly traded corporations that require monthly premiums in return for paying for part of your medical costs. Michael's now going to take us on a little bit of a deeper dive of the government and commercial plans available to families in Arizona. Michael?
Good afternoon. This portion of the discussion is going to cover a couple different entities that are within the government plans. One known as Arizona Healthcare Cost Containment System, which is our state Medicaid system. Some of the components that are involved in eligibility for these programs consist of Arizona residency, household income being less than certain percentages in order to qualify. Percentages start with families and children anywhere from 147%, which represents from birth to 1 year of age. Anything for children over the age of 1 year, it goes to 141% of the FPL, and that's going to cover a range of 1 to 5 in age for the child. Beyond that, it then becomes a universal percentage for the entire family household at 133%, which is what it currently is as of today. Some of the programs that DES, the Department of Economic Security, who overviews the eligibility criteria for the access programs, there's a few different components within that system, one of which is a Family Assistance Administration. They determine Medicaid eligibility for children, families, and non-disabled adults under the age of 65. Some of the other components are a comprehensive medical and dental program, which is offered through Access. It's a contracted health plan to provide medical services for children in the foster care environment who are not in their biological setting with their biological parent. Some of the other components that are readily available and also in that program, divisions of child support enforcement. There's also disability determination services administration, and then division of developmental disabilities, which is another component. Some of the programs that are involved in the access system from a simple form are going to be standard qualifying coverage such as your Mercy Care Plan, United Healthcare Community Care Plan. Those are all set up to follow the standard rule of those numbers and percentages that I just went over. There are other programs within there that are more unique to the care needs of the individual. That program specifically speaks to supplemental security income, which is driven through the federal government, which is Social Security Administration. That program has two components. The one component is going to be based on the income allowable that the family is entitled to or that individual is entitled to based on, again, their disability criteria that they're meeting. The other is going to be the medical assistance only program. This is going to be specifically for medical benefits to cover medical needs of that individual who's covered within that program. That program is going to follow the same criteria, very similar to the standard access criteria based on the federal poverty level, which is those percentages that we went over prior. The one program that they do offer in there, which is specifically based on diagnosis, not versus income of the household, is going to be the Arizona Long-Term Care Services, which is short known as ALTEC system. This is going to be something, again, that's more based for children that need services that are diagnosis-based, so the family's income household level is not going to be the primary component, more so the diagnosis of the child. Another one of the programs that's out there that's very common in the state of Arizona is Indian Health Services. This is for our Native American population that is either tied to a local reservation here in the state of Arizona or currently resides within on a reservation currently for the state of Arizona. That's also one of the plans that's very unique in keeping all of the different categories as simplified as possible. Commercial plans. Some of the commercial plan options that are changing and evolving every day, some of the ones that are commonly known today are the HMOs and the PPOs. HMO is a health maintenance organization. It's a type of insurance plan that usually limits coverage to the care from providers that are within that select network that's chosen by the plan. These plans generally will require PCP referrals for other services that are needed within that market of what that patient's needs are. A PPO is going to be more of a preferred provider organization. It's going to have a little bit more flexibility with regards to traveling for different services you need. This does not require any type of referral from a primary care physician. You more so than not have the option and choice to choose where you go for your care. The differences between the two are going to be, again, based on your needs and your care needs of your patient and the individual, and also are going to carry different cost measures between the two of them. Some other commercial plans that are out there that are a little bit more current and were brought up over the past few years are plans such as the Exclusive Provider Organization, the EPO plan. This is a managed care plan where services are covered only if you go to doctors, specialists, hospitals in that plan's network, with exception to emergency. EPO is going to perform very similar to an HMO plan. They're going to drive where you can go. You need a PCP, and in most cases need the referrals to these other service areas that you're going to require. Point of service is another plan. Point of service plans are going to be modeled similar to that of a PPO plan, where you're going to have more choice as far as where you go, but some of the care that you're going to need may very well need a referral from your primary care doctor to see a certain specialist. But your range is going to be a little bit more open than that of an HMO plan as far as where you can go. Consumer-directed health plan, that one is going to be a type of plan that has a high deductible and out-of-pocket amounts where the insured is encouraged to shop for the best price for their health care. Health savings accounts typically are going to be attached to that in order to bring down the out-of-pocket cost impact that those plans are going to carry, which again can have the tendency of being higher than the traditional plans previously discussed. Here's some of the options that we have as far as what's going on now within the marketplace regarding commercial insurance plans, and even that of what qualifications are being met by the family based on their household income. Some of the percentages that you'll see here range from 100 to 400% of the federal poverty level, which is the FPL. And again, this is based on what type of subsidies are being offered through the federal marketplace that are also determining where you fall as far as what the cost of that coverage will end up being. As you can see through the range of cost parameter, up to 133% of FPL, you are generally going to be looking at about a 2% of your income was the cost of what that health care coverage for yourself would be based on your household income, and all the way down to as high as 9.5% of income for those whose federal poverty levels are somewhat higher, 300 to 400% range. Cost-sharing subsidies are going to be items where your co-insurances, your out-of-pocket, after insurance portions are going to come into play. So these are more commonly known as patient responsibility portions. Again, annual out-of-pocket maximums, deductibles, and co-insurances. Again, the FPL range, as you can see, the 100 to 150% would qualify you for a 94% subsidy in that particular financial scenario. and then all the way down to a 70 percentile if you fall between the 250 to 400% FPL range. Deductibles and coinsurances are two of the primary components in all healthcare coverages that are commercial plans that are out there. They're very commonly known. Deductibles are generally going to be what is also known as first dollar for services that deductibles are going to be involved with as far as for the care that you need. Those items are going to be usually driven by your healthcare plan and are going to be very specific to where that deductible is going to apply and where it does not. The amount that you owe for healthcare services before your health insurance plan begins to pay. That's another way to look at it. For example, if your deductible is $1,000, your plan won't pay for services until you've paid that $1,000 again, which is that first dollar amount. Meeting your deductible amount, the deductible may not apply to all services again, so it's going to be very important that when you review your benefits for that particular plan, that you look and see where exactly does the deductible apply. Coinsurance generally is going to be what is also known as second dollar. Coinsurance is going to be based on a percentage after that said deductible is met, or for services where a deductible is not included and it's directly a coinsurance based event. Your share of the cost of coverage for healthcare services is calculated as a percent. For example, 20% of the allowed amount for the service, you pay coinsurance plus any deductible that you owe. So for example, if the health insurance or plan's allowed amount for an office visit is $100 and you've met your deductible already, your coinsurance payment of 20% would be $20. However, if your deductible has not been met, then your responsibility as a member is going to be the allowable amount if that is the lesser of the remaining deductible that you have with the plan that you are currently on. Some other components that we have are going to be copays and out-of-pocket maximums and limits. Copays are a fixed amount. For example, primary care doctor office visit may have a copay for $25. That's a reoccurring dollar amount that generally does not go into any of those two prior categories. Those are going to be reoccurring dollar amounts. That's going to be your cost for that particular service event based on your plan. You pay for the covered health care service, usually due when you get the service. So time of service, again, in the doctor's office is going to be the most common place you'll find a copay. Other places are urgent care visits, some emergency room visits. They'll have just the specific copay related to that service. Out-of-pocket maximums and limits, the most you pay during a policy year, again, it's very important to keep in mind that policy year does not always line up with calendar year. So knowing that information is generally going to be provided when you begin with that particular plan, and is always a question that I would always encourage for anyone to ask their plan. When do their benefits year, when does it reset? But that again is going to represent the maximum that you're going to pay. Now that maximum is going to be a combined total of your deductible as well as a coinsurance in most cases. And it's very important for you to know when that begins and where it ends, so then that way you can maximize the most of your policy, especially when you have maybe a year that is involving a lot of healthcare needs and an outpatient in a facility or in a doctor's office. Some of the other items that you're going to want to pay attention to on this is going to be in-network and out-of-network provider networks. Reason being is a lot of the healthcare plans and the changes in the market as continuously being changed is what type of plans have what type of benefits within network, and if there is even out-of-network benefits. It's a tremendously important piece of information to know because your care necessities may not always fall into an in-network scenario. So you want to make sure that you do have coverage for those events should they come up. Definition of an in-network, out-of-network plan is going to be provider networks are the group of providers that an insurance plan is contracted with for a specific plan or group of plans. If the provider is in network, you will have full benefits according to your policy when receiving healthcare services from that provider. If the provider is out of network, you'll either receive a lower benefit and pay higher out-of-pocket costs, or will have no benefit, meaning all charges are your responsibility, which could be very costly depending on the services that are involved. Excluded services, the definition with that also is very important to understand with your policy. These are services that are specifically not covered by your insurance plan. This will vary by plan, but a common exclusion is cosmetic services. In most insurances, that's a pretty universal item that a lot of them will not cover, and you may very well be responsible for the total cost for that event. Covered benefits, those are services that are specifically included in your insurance plan and are usually readily identifiable within the summary of your benefit, which your benefits provider, your insurance plan can provide at request. Essential services are another thing that you want to pay attention to. Essential services under the Affordable Care Act are all health plans must cover 10 essential services defined as ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, along with preventative services, including oral and vision care. Pediatric can be standalone. Allowed amount is another component that is very important for our families and for members of insurance to understand with regards to their plan and the providers that they choose to receive services through. An allowed amount is going to be what is a contracted amount, which is what the plan has already predetermined for the services that you require. So, for example, if you have a charge of $10,000, however, the plan has a negotiated allowable amount of $2,000, then the $2,000 is the amount that your division is going to start to take place based on. Again, regarding deductibles, if it's a deductible-based service, co-insurance-based services, it's not going to be built on the charged amount, it's going to be built on the allowable amount, and that's very important for you to understand the difference between the two, because there could be a very significant difference in some cases. So it's good to be informed, in which anyone in the provider setting and or the insurance setting can go over that and explain in detail to help you understand that better. But some of the items that are out there that are common, if you have an x-ray and the charge billed to the insurance company, again, is $250. The provider has a contract with the insurance plan, however, to perform that service for $200. The insurance company will pay $200, again, minus any deductible, co-insurance owed by you, defined by your plan, to that provider. The provider will accept that as payment in full. Again, that is known by several different names. The allowed amount or contracted insurance amount are some of the more commonly used terms when defining that. A few more things to understand is, again, related to in-network, out-of-network, regarding balance billing. Balance billing, when you seek healthcare services from an out-of-network provider, your out-of-network benefits will typically be less than your in-network benefits. If your plan will cover part of the cost of that care, the provider may bill you for the remainder of the charges, and this is known as balance billing because that out-of-network agreement is not going to be the same as an in-network agreement. In-network agreement is going to be, again, a contracted language that's used between the healthcare plan and the provider, negotiating the rate for the services of their member and our patient. Patient liability is going to be the amount that you owe for healthcare services rendered. It may include copay, deductible, co-insurance, total charges, and or balance billing. Some of the items that we just recently went over, patient liability is going to be a post-insurance processing of the claim. And final thoughts for what we want to pay attention to is, did you purchase your plan on the marketplace last year? If so, you must log in and select a new plan if you want to change plans during the open enrollment period. Otherwise, you will be re-enrolled in the same plan, and that plan may have changes that are going to come up for the new calendar year that may differ from the way that the behavior of your plan is currently. So it's very important to review that and make that decision. Were you receiving government subsidies based on your income and plan selection? Pay very close attention to new additions to the marketplace. Subsidies were based on selecting the second lowest silver plan available. New plans may have entered that are lower cost and therefore make your current plan ineligible for those subsidies. So very important to have these discussions with a qualified individual, whether it be on the insurance plan side or the provider side, for further direction and help understanding those changes. And thank you. I'm going to give you back to Laura to go over some other considerations when selecting your plan.
Thank you, Michael. I think he did a really good job of giving us some very comprehensive definitions of what goes into your health plan, what goes into insurance, and what goes into kind of the payment process overall. So we're going to take all that information, we're going to start putting it together. I know it took a long time to go through the definitions, but we want to make sure that we're all on the same page and we all have the same language before we move forward with putting that into action. So we want to talk about now about, open enrollment is coming, and what do you need to think about when you're selecting a plan? And basically we can break this down into 4 areas that you should think about when you're doing your plan comparison, because there'll be a lot of options available to you, whether you're on the marketplace, whether your employer is offering different plans, whether you're looking at government options as well. And the 4 areas that we're going to talk about are, number 1, your budget. What is it that you're able to afford out of pocket? And we'll talk about, the monthly component versus the overall, cost of coverage. You want to talk about your health and your family's health, and, what are your expectations over the next year? What have you seen in the past, year or so? We'll talk about your lifestyle. There's some specific things that may affect what type of plan you want to select. And you want to take into consider current relationships you have with physicians and provider relationships, because as we talked a little bit earlier, and we'll talk in more detail as we go along, there are what we are calling, or what have been referred to as narrow networks, which are the HMOs and the EPO plans, where you may not have a wide selection of providers, so you're going to want to make sure if you have those relationships that you take that into account when you select your plan. So let's talk a little bit in more detail about your budget. There are some basic things to look at. So everybody has monthly constraints on their budget. So what is it that what do you currently pay for insurance premiums each month? What are you willing to pay each month for insurance? Do you maintain a savings account for unplanned medical expenses? And there's different kinds of savings plans there, depending on whether or not you have a consumer-directed health plan that where you can get a health savings account, which acts differently than a flexible spending account. But both of those are mechanisms to put away dollars pre-tax to help pay for your unplanned medical expenses. How much did you spend on healthcare last year, including your prescriptions? It may not be an accurate representation of what you'll spend in the future. We don't have a crystal ball. However, it will give you some history. And if you're on maintenance medications, you will probably need those again in the coming year. Another thing to consider in your budget, are you eligible to receive financial assistance to lower the cost of health insurance premiums and out-of-pocket expenses? Michael talked about the 2 areas available through the marketplace for cost-sharing subsidies and tax credits that both buy down the amount of your monthly premium plus your co-pays, your co-insurance and deductible amounts. So those can both come into account and help you in your selection of the health plan that's right for you. So you also want to look at your family's health. What are the care needs of you and your family members? Do you have family members that have chronic needs that you're going to have ongoing care for? Are you in the middle of a course of treatment that you're going to need to carry over through the next plan year? Just looking at how many times you saw your doctor last year, sometimes that's a good predictor of what your needs are going to look like in the future. Lifestyle is also an important category to look at when you're considering your health plan. Who in your household needs health insurance? Everybody may have a different need. Your spouse may have insurance through their employer, but it won't cover you and your children. So you may have different needs depending on your family. Are you between jobs? So there are options for COBRA coverage if you're between jobs. Is it a temporary time between jobs, or do you think this might be an extended period where you're not working? So do you need the insurance for a short amount of time or a long period of time? And those will both play into your decision, or could play into your decision. And one of the really important things when deciding whether you want, an HMO versus a PPO type of plan, do you need coverage outside of the state or outside of Arizona, outside of this immediate area? And examples of that are, do you have a child that's going to college in another state? Do you travel for work? Are you outside of the state? Are you outside of the country where if something happens, you're going to need to access health care? And then finally, your physician and provider relationships. So when you're if anybody in your family is in the course of treatment for a specific illness, and you have that established relationship and you have that history, that may be very important for you to carry forward into the next plan year. So it's really key that when you're selecting your health plan, you look and make sure that those providers and all of the providers, whether it's the physicians, the hospitals, any radiology lab providers that you've been accessing are part of that plan that you select. Do you have an established relationship with your pediatrician, for example? Are there, even if you're not in the course of treatment or nobody in your family is in the course of treatment, is there a specific facility, for example, or a physician that you want to make sure you've got in your network just in case something comes up? You want to have that provider available to you to treat your family. So we're going to look at some plan comparisons. We're going to walk through. These are high level and they're very simple, but I think once we get to the end of this, you'll see that even with the simple examples, the choices can be a little bit daunting. So Michael's going to walk us through these plans and some high level kind of scenarios.
Okay, so going back to what we were covering prior with regards to the differences between the plans and out-of-pocket limits, co-pays, deductibles, plan types, all of those details, those are broken out here in a few basic plan scenarios. So as you can see, in a couple of the plan scenarios, we'll have your premium, which is going to be your monthly impact. That's generally going to be one of the primary costs that a lot of families consider in today's market, because a lot of us who have different roles and different jobs, our pay scales vary, and we calculate every single penny and dime to make sure that our needs are being met. And a premium for insurance is one of those items that is worked into your budget as a very important item. Some of the plan details, as you can see on here, are going to be HMOs, and then on the very final plan is going to be a PPO model. As you can see, the plan's premiums, they shift somewhat in the first plan in A and plan B. Those are very similar in a lot of components if you're looking at the details, from the office visit primary responsibility to an office visit specialist, deductibles, co-insurances, emergency room costs, hospitalization, and that out-of-pocket limit that you'll reach within that benefits year. The difference between the plans as you start to shift over to Plan C, still an HMO, however, if you look at some of the details of that cost for the same items as Plan A and Plan B's description, you'll see there's a slight variance in your favor as a patient on everything outside of that monthly premium. So essentially the impact of cost is going to be upfront and going to be on a monthly basis for the premium plan in order to drive down some of those out-of-pocket costs. These two different scenarios may be very relevant based on what Laura just covered and what we covered prior on the specifics behind your family or the care needs of the individual and or the family as a household unit. And some items are, very predictable. So you may want to choose to go with something that is a little higher out of pocket and predictable each month if available and possible, because you know that you're going to reach that out of pocket limit, let's say, every year reoccurring if you have reoccurring services and high level care items that are required reoccurring. But again, however, you're going to want to measure which one is going to work best for the items that Laura had covered, which is lifestyle, budget. All those things are very relevant. Provider, your physician relationships, do they fall into the category as being in-network providers in some of these scenarios? So those are some things that are going to go into the numbers that you see in front of you. Now, here's a scenario of a patient that will apply in each one of those categories, which is going to have the following items. 2 visits to the primary care physician. The charges for that, each visit is $750 per visit. The allowed amount, however, with an insurance plan might bring that to $500 based on those plans we just reviewed. Patient also has 1 visit with a specialist. Charges a $1,500 charge for that particular visit. However, the insurance allowed amount, which is that contracted rate that your insurance has pre-negotiated with that provider that you're seeking those services with, is only $1,000. Let's say that also you add a trip to the emergency department. Those charges can be up to $7,500 in this scenario, and the allowed amount is $5,000 based on those particular insurance descriptions we showed. Then you also have 1 inpatient hospitalization. Charges are $25,000. However, the allowed amount with the insurance is $10,000. Now here is the same plans that we just showed 2 slides ago, which is going to go over how those plans are impacted by those services that we just showed in that scenario. So as you can see, as you go across the same plans, the way that they're lined up, you're going to pay close attention to the very top line again, which is your premium cost. That's a known cost, reoccurring every month, and it's predictable. As are your deductibles and what your policy provisions are in detail for co-insurance, co-pays, etc. However, based on that care scenario that might not have been predictable, you scroll towards the bottom of the list and you're going to see what the comparison looks like at the end of a benefit year for those services that you sought out for. And in most cases, as you look along the bottom line, those numbers don't really have much of a variance from A to D as far as the final impact. However, row above that bottom line number and the 2 above that are going to show you actually what part of that bottom line total number consisted of that monthly premium multiplied through the course of the year, which in Plan A, for example, your total premium cost for a 12-month year is $4,098.36. Your total cost of your care didn't quite was above the actual out-of-pocket limit. So in that scenario, that's where your total impact was at $10,448.36. Now, if you go across over to the larger plan, which we used in the example prior, Plan C, also an HMO, slightly higher premium payment, again, up front. That total cost is going to run about $6,606, so about a $2,500 increase from option A. Again, both HMOs. However, the makeup of the impact from that scenario and those visits and services that were established shows a lesser amount out of pocket in comparison to Plan A. So the bottom line numbers are going to be very comparable. However, how you got to that number and where that money is being spent is going to be something that we all don't always have an opportunity to decide as far as when the money's spent. Premiums are predictable, however, healthcare concerns and needs that arise in emergency circumstances especially, they're not predictable always. So it's very important to pick a plan that is sustainable for your budget, your lifestyle, your physician preference, and those items that we have covered so far. And the next part is going to be, what if our patient receives services from a narrow network? This is a very big one, and I'm going to turn it over to Laura again to explain that, as that's an ever-evolving area as well. Thank you.
Thank you, Michael. So what if during the course of the year you get a diagnosis that sends you to a specialist, and that specialist is not part of your network? And in the course of your treatment, you end up with a hospitalization, and you have to go to a hospital that's out of your network. So we're taking the same set of services, except that in this case, the network the specialist is out of network, and the hospital that you're visiting is out of network. So let's see what a difference that makes in the cost of these plans. So we're going to bring this slide back up, only now we've got some out-of-network issues going on. So go back to Plan A, the one Michael was using as an example. And so, you know, the office visit, the primary care is the same, but the specialist now, instead of paying that $100 copay, this HMO has no out-of-network benefits. So you're now going to pay the cost of those visits, which is $1,500. And guess what? That $1,500 does not apply to your deductible, nor does it apply to your out-of-network, because you don't have a benefit for it. That's just cash out of your pocket. You go to the emergency room. The emergency room was in network, so you're okay on that one. But you go to the hospitalization, you get hospitalized, and then instead of your $1,000 copay for the hospital, again, you're going to be hit with that bill for $25,000. I mean, most people that I know don't have that money sitting around to be able to pay for that. So now your total cost of care goes to $31,500. You're out of pocket. You might think you're okay because your out-of-pocket limit is $6,350. But guess what? Since your hospitalization charges and your specialist charges don't apply to your out-of-pocket, you really actually haven't hit that out-of-pocket limit yet. So you're going to have to add that $31,500 to the cost of your premium, which was $4,098, and your total out-of-pocket expense for that year's services goes from $10,000 up to $35,600. So that's a huge increase, and that just shows you the impact of going out of network for your care when you're in an HMO. So if you go across the spectrum here, the thing that you'll find when you go over to Plan D, which is your PPO, here you've got a plan that you actually do have some out-of-network benefits. So while in the example before where you did not go out of network, the least expensive plan was the Plan C, with your total out-of-pocket cost being about $9,000. In this scenario, when you've had to go out of network for your services, Plan D ends up being the least expensive plan for your family, with an out-of-pocket of $14,613. The reason for this is because you've got that out-of-network benefit. Now, granted, it's higher, so you look at your office visit for your specialist. Instead of the $50 copay, you're going to pay a 20% out-of-network, so you're going to pay $300. But that $300 is a lot more affordable than the $1,500 when you have no out-of-pocket benefits. Again, when you look at the hospital charges, you've got a 20% coinsurance on your out-of-network hospital charges, so then you're going to pay $5,000. And again, that $5,000 may seem astronomical, but it's 1/5 of $25,000. The other thing I wanted to point out on this scenario is where you look at somebody who doesn't have insurance. Now, I think we all know that the Affordable Care Act has mandated that we all purchase insurance. There are a lot of people who are not doing that. The penalties go up every year as time goes by, and there are some people that get waivers. However, if this is just for illustrative purposes. I think having coverage is a good thing. But this shows that when you're going out of network, in this scenario, going out of network is about, having no insurance is about the same cost as having an HMO and getting your services out of network. So this, again, just goes back to the importance of that last bullet of making sure your providers are included in the network, in the plan that you select. As we've looked at these plans, again, we look at the 4 areas. We look at budget. From a budget standpoint, in the other scenario, Plan C made the most sense. In this scenario, Plan D makes the most sense. So you have to kind of fold these areas together. So your lifestyle, are you between jobs? If you're between jobs and it's going to be a short period of time, maybe you want to select Plan A. Just pay the smaller premiums for a couple of months, and if you can delay the services, then that will be a good transition until you get into a new job and other coverage. Again, if you've got a child that's in college, away at college, Plan D makes the most sense because then you'll have those out-of-network benefits. We've already talked about the physician and provider relationships. So we hope the information that we've provided to you has been helpful. I think what we've shown is, even with this very simple example, very limited scope of benefits from actual plans that are available in the marketplace, a very limited list of services provided, and some basic decision making, that even with this small scope that we've provided, it's a complex decision. I mean, there are so many things that can change this based on your circumstances. At Phoenix Children's Hospital, our family financial services counselors are here to assist you in this process. We can help you in walking through these decisions, having these conversations. We can help you apply for coverage on the marketplace. We can help you with your access application if you are qualified for some of the government programs. And we also can walk you through our financial assistance program that we have here. Again, I just want to emphasize our phone number is here, 602-933-2000. We've got an email address if you prefer to send us an email. We're here to assist you. We understand that this is complicated and it continues to get more and more complicated each year. So please reach out, contact us, and let us be of help to you as you go through open enrollment. And with that, we'd just like to thank you for your time today.